This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the world-renowned, one and only, Dr. Jason Martin.
Number one.
He's board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Doing pretty good, Amy. How you doing?
I'm good. As one little caveat here on episode 97, we are having a little bit of a windstorm today, so if you hear some metal scraping sounds, it's
the way it goes.
Blame Jack Sparrow, pirate on the roof.
We don't care about the weather.
Chains around.
We still podcast.
Yep. So if you are listening to this podcast and you'd like to watch the slides that go along with it, you can find those on our YouTube channel at Jason Martin MD, and we are on Instagram at Beauty and Surgeon Podcast. Today we have a very interesting topic. It's probably one of our most frequently asked questions, and that question is...
How much does it cost?
Yes, how much does it cost? And I get it, right? A lot of people preface that question with, I need to know a range because if it's, you need to know if I'm even in the ballpark.
Right.
Is
it $100 or is it $20,000?
Yes.
I need to know kind of where we're starting from. Amy and I are both frugal people by nature. We get it. We don't shy away from discussing about money, but there's a lot of things that contribute to costs, and we're going to talk about that today.
Yes. All right. So let's get started. So the first thing that you need to think about when you're thinking about how much the surgery cost is it depends. The very specific, it depends.
So everyone's going to be watching this. I want to know exactly how much my surgery costs.
And it depends.
It depends.
What are some of the things it depends upon?
Okay, it depends on the location.
Geographic location, where you are in the world.
What type of procedure you're doing, either by itself or in concert with other procedures. So the time of the surgery. If you have any associated treatments with that, right? Which I guess we have in the slide, technology.
Yep, use of technology.
If there's, for example, we do body contouring. You can do liposuction alone. It's great. If you add Body Tight, it's better. And that's the truth.
And that has an expensive disposable that goes along with it.
But that costs money. So that's a decision you make. On here, you have previous surgeries. What are you referring to with that?
That depends. I mean, if you've had 3 breast surgeries and you want a breast implant exchange, your breast dog is not going to cost the same as someone who has never had their breast worked on before.
Yeah. That's so true.
If you have massive capsules, if you need other things, like if you've had a tummy tuck before, or you've had a bad facelift.
Yeah, so
you have horrible scars.
We'll get to this part, but definitely if you have problems from previous surgeries, especially if the person you're going to didn't do the surgery, you're going to get a surcharge on that. That's
it's not even a surcharge. It's a technicality charge. I mean, if we're having to fix your bad scars or your surgery, that
surcharge is probably not the right word.
Yeah, it's going to be more complicated. And that the breast surgery, I think, is a great example of that. Like a woman who's having her first breast augmentation versus her 5th, drastically probably different cost because the approach, everything is probably a lot different.
Right. Yeah. So the cost of surgery has a lot of components that add in.
We will talk about those components.
Yeah. But there are many outlying factors that add costs or take away costs. And, I think that's the thing where people get confused. What happens when they're talking, so they're talking to their friend had a surgery and they're like, well, I'm going to have that surgery, so I should pay the same. Well, your friend, say it's a breast augmentation, did your friend have the same type of implant? Does she have something else done with the surgery itself? Does she have a lift with it? What approach did they use? That approach may add or take away time.
Where did she have it done?
Where did she have it done? Did they have to use grafts in the surgery itself? So there's so many different factors that can affect this cost that aren't just related to this is the surgery I'm doing with this doctor.
Yeah.
So,
and one thing that I did not put on here that I feel like is very important for us to talk about is who is doing your surgery, meaning are you going to a board-certified plastic surgeon? Because there are a lot of doctors, I'm using doctors, who do surgeries that they may have taken a 1-hour course to do, especially things that are done in the office, body contouring. Are they an actual board certified plastic surgeon? Are they a board certified anything? Are they an OBGYN who decided to start doing lipo? Are they an ER doctor?
And call themselves a cosmetic surgeon.
Right, call themselves. There is no ethics board for doctors who are not part of a board. So a regular doctor, just doctor off the street, can call themselves even a plastic surgeon. They can say that. It doesn't mean it's true. So I would highly recommend you, before you group on a surgery or try to find the cheapest surgery you can, to remember that the person you're going to, while they may be a doctor, they may not be a board certified doctor, a board certified anything. Mm-hmm. And that is very important to consider when you're considering the cost of surgery. This is your body, this is your life. This is not the time to find the cheapest surgery you can. Yeah. Or the cheapest thing you can. You certainly can do that. And there are doctors out there who run Groupons for body tight and Groupons for liposuction and Groupons for breast augmentation. And that's totally fine. But
is Groupon still a thing anymore?
Yeah.
Okay.
Groupon is a thing. I actually used to Groupon not that long ago.
Oh, really?
Yeah.
For what?
For bubble tea. For boba. Yeah. Mm-hmm. At DIY Tea Labs. Shout out to DIY Tea Labs.
I have no idea what you're talking about.
Bubble tea. It's delicious.
What kind of tea is it?
Well, it's any kind of tea. I mean, there's many kinds of tea.
Oh, that's the brand.
It has the boba in it, like
I don't know what boba is.
Yeah, you get the big, thick straw and you suck the boba chunks through. It's basically like having like gummy bears in your tea. It's delicious.
So it's like when you get hot chocolate and you get the little dried marmarshmallows and it's the same idea.
They're chewy and they sink to the bottom. They're delicious. Oh, it's so good.
So disgusting.
so delicious. But yeah, I definitely think it's
all right.
Yeah. So get a Groupon for some boba tea, but not for your lipo. All right. So let's talk about getting a little more
we're going to break this
deep
down.
into what goes into the cost of your surgery.
So the idea about people listening to this is to empower you. Okay. So you can understand exactly where these costs come from. If you go to an office and they take a legal notepad and write a number on it
note.
And turn it towards you, leave. Okay. It should be itemized, just like everything else in the world. Now, healthcare is a terrible business for the consumer. You never know what you're paying for in healthcare, it seems like. I personally have insurance. I've done, things related to insurance, and it's so hard to understand those bills. A cosmetic surgeon's office, specifically a board-certified plastic surgeon, should be able to itemize everything for you. This is not one of those situations. It should be very clear. Now, there may be a situation where if we do this or don't do this in the OR, you may get an extra charge. They should be able to elucidate that for you too. So everything needs to be spelled out. And when you do that, then you can compare apples to apples. If you get multiple consults and this person's surgeon's fees are $8,000 and that one's $6,000, you can call up and if you like the $8,000 one, say, why is it $8,000? And they're probably going to tell you because it is. That's what we charge. But the reality of it is, at least you're paying a little bit more.
I would highly recommend not doing that.
Why?
Well, I mean, I can tell you this because I highly value your skills. So when people call and are asking me for unrealistic discounts on your services, that's just not going to happen.
Right. You can at least ask them. Yeah.
I guess you can, but the price I quote is very fair. This is not a car dealership. I'm not going to negotiate our prices with people because what I am offering is an amazing skill. So.
No, I understand that. So what I'm saying is, at the very least, it's itemized so you know what you're paying
Correct.
for. Okay.
Yeah.
So let's go through this. Dollars and cents of surgery costs.
So the number one thing on there is, of course, the surgeon's fees. So surgeon's fees, obviously, you are going to a surgeon for surgery. Their fees are probably going to be the biggest part of your surgery is the fee for the actual surgeon's skill, his time, all that stuff.
And what is that worth? Well, number one, do your research before you go. Make sure they're board certified. Make sure they're good at the surgery that you want. Look at those reviews. Go in and meet with them. Do a consult. See if you get a good read on that situation and see if you like their plan. If you do, if you like that, if that's what you're feeling, then you should consider that surgeon, even if it's a little more than another surgeon down the road that you didn't have a good feeling with. Is going with someone you don't have a good feeling with worth $1,000 for your body or $2,000? I don't think so. That's Amy's opinion. That's my opinion. But I think that the surgeon's fee is going to be important, but it's not going to be the overall deciding factor. It should not be.
Yep. So the second thing that's going to be probably your second expense is going to be the operating or the facility fee. So whether that's a hospital operating room, a surgery center, an in-office facility fee, whatever it is, that facility fee is also based on the time of surgery and the complexity of surgery. So it's going to include things like how long you're in the OR for, how many sutures are they using? How many assistants are needed? Like all that
So
kind
how
of
do
stuff.
they charge for that? Do they charge for that by 15-minute increments? Do they charge by the surgery you're doing?
Depends on the facility.
Yeah, see, every facility is different.
Every facility is different. Typically, surgery centers will charge by 15-minute or 30-minute increments,
Right.
with a minimum of like usually 30 minutes. Most bigger hospitals are going to have it broken down by service code, and they do that. I mean, this is all when you're getting into that, hospital surgery centers. They base this on how much every single minute of every single procedure costs, how many sutures the surgeon uses, how many bags of IV fluid they're going to be taking up, how many of the Bovie tips they're going to use. Like literally every single thing has an exact amount. They itemize that for every single procedure code, average it out over all the surgeons that are there, and that's the price per code. Now, when you combine codes, they usually have primary and secondary codes. So meaning primary is your top procedure. You might have 5 other procedures that are all going to be secondary codes. So there's a slight discount for combining procedures. Whereas if you're just going by time, it's just time.
Right.
So
surgery centers, when they do by time, they front load the cost, right? And then it goes down over time. So every hour it kind of decreases. That's the usual paradigm.
Every 15 minutes.
Okay.
Yeah, it gets a little bit less.
Okay, a little bit less.
Or most of them, though, it's one set fee for the first 60 minutes. And then every 15 minutes on top of that is an additional set fee.
Gotcha.
So it's not like it gets incrementally lower after that. It just means that after that first hour, every 15 minutes is this amount up to 7 hours.
Right. And the workaround that some surgeons get is they put their own OR in their office. Right. And they don't have to deal with some of these elements.
But there's still, even if you have an in-office OR, there's still going to be a facility fee that's in there somewhere. So whether that's in the additional surgeon's fees, if you don't see a facility fee on there, even if your procedure is in an office OR, it probably exists somewhere. Like those costs have to come from somewhere. Mm-hmm. So those are supplies. I mean, literally everything that is used, every tiny little 4x4, every pick, everything that's used in that surgery, the sheets you're laying on, everything is cost broken down by a facility so that they know how much your case is going to cost them. And we know that too.
Yeah. And some people are like, oh, that doesn't make sense. I'm like, well, have you ever had a contractor come to your house? Do they go to Home Depot and just buy your supplies for you? I mean, they may, but you're going to end up paying for it.
Right. You're paying for it somewhere.
That's the way this works. Yep. It's a transaction, and these facilities, especially if it's not the surgeon's office, are going to charge you for what their expense is, and then they're going to make a profit off of you. Now, in most cases, those profits aren't extreme, okay? But they're not
very low for most places.
Yeah, they're usually probably 10 to 20% at the most, okay? And that's pretty good. So when you see this huge number from your facility, that's how much these things cost. Amy, what does like a pack of sutures cost?
Oh my goodness, there are some sutures that are upwards of $100 a pack.
For one pack?
For one pack.
I did a facelift today and a neck lift. I used
probably 30.
30.
Plus 2 staple guns.
30 packs. That's $3,000 in suture material. Okay. Everything in medicine costs a lot of money. Everything has to be sterile. Sterility costs a lot of money. And guess what happened with COVID? All these prices went up. Yep. All these things come from China and Haiti and all these Puerto Rico, and it's difficult to get things in, and et cetera, et cetera. These things are expensive. Healthcare is extremely expensive in the United States. So,
well, that includes, I mean, to go on that even farther, the masks, the gowns, the scrub, the soap that people use to scrub in, the medications you're given,
the lights, the air filtering system, what Oxygen. That costs per room, the personnel. The computer system, I mean, they're going to charge for it. They're going to make their 10 to 20% guaranteed. And by the way, a doctor's office will too. A doctor's office will not take the hit. They may act like they're going to. They may say, we'll give you a discount. But the reality of it is they're going to cover their costs, just like any other business. No, I mean, there's rare is the business that takes a hit on the cost. I mean, Amazon did that for like 15 years, but they were obviously a technology company. Like a freestanding service business is going to cover their costs. They have to. That's how they stay afloat. Yeah. So the operating room and facility fees, wherever you go, are going to be large. Not as large as the surgeon's fees, but they're going to have a cost to them. And in most cases, I would assume that those aren't extravagant. Now, operating room fees and facility fees will differ per region. Okay. If you come Denver compared to New York City, Denver's going to be a lot less. Denver compared to Omaha, Denver's probably going to be more expensive. Yeah. And that's just the cost of doing business in more popular places. Everything's more expensive besides the supplies. The staff is more expensive, all that kind of stuff because of cost of living. I mean, it all equates. So, if you live in Omaha and you want to come see us in Denver, that's great. But you're going to pay more for the facility fee than you would in your hometown.
Yep. Yeah. So then step down from there is going to be the anesthesia fee. There are several types. We have a great podcast. It's an old one. I'm doing this to Nils again. Our podcast with Dr. Don Merrill. He's an anesthesiologist. We talk a lot about the difference between.
Showing like those are super old. Those are like
they're
the
good
first
ones.
20.
They are not on YouTube because they're not video, but they're that old. Talk a lot about anesthesia, the safety. It's a really fascinating podcast to listen to if you're going to be having surgery.
We should do that again.
We should. Something we didn't talk a lot about in that podcast, but does play into the fees here, is whether you're having an actual anesthesiologist, meaning he's an MD, he's a doctor, or a nurse anesthetist. That will vary the price pretty greatly. We no longer work with nurse anesthetists. We only work with anesthesiologists. In the past,
we work with groups that are run by anesthesiologists. They do have some anesthesia assistants and CRNAs, but they're supervised. What you're saying is we don't work with CRNAs alone.
Correct.
In the state of Colorado, you can do a procedure with a CRNA with no MD supervision. Yep. And there's a lot of other states in the United States where you can do that, and there's a lot of states where you can't. So, the CRNA, which is the mid-level, great with what they do, they're going to be less expensive than a full-fledged MD.
Yep. A lot less expensive. Mm-hmm. I mean, we did, for a while, we worked at a surgery center that did allow nurse anesthetists, and we did use one for some time, but we don't work at that facility anymore, and have just made the decision to go with a group that is all.
And what was the price difference in that per memory?
It was about a third.
A third of the cost? Wow. That's a big difference.
Yep. So it was a big difference. In the end, is that worth it? That's a decision that everybody needs to make. I think probably one of the biggest fears for most people going into surgery is the anesthesia component. And knowing that you have, an anesthesiologist doing your surgery, I think gives a lot of people peace of mind. That is actually probably a far more common question than is Dr. Martin board certified is, do you use anesthesiologists or nurse
Which is so crazy to me. Like, can you ask me if I'm board certified, please? I mean, I am, but no one seems to ask that. But they absolutely are very interested in who my anesthesiologist is. Is he an MD or her an MD? That kind of stuff. So, we're not anti-CRNA, just FYI. Amy and I are both not. We're very supportive of CRNAs, but not having a team approach with MDs, CRNAs, and anesthesia assistants to me makes me more comfortable because they're all working together as opposed to have this sole CRNA over here, or even a sole anesthesiologist by themselves at a facility with no backup makes it a little bit more tenuous.
Yeah. Something else with the anesthesia fee may be additional cost for long-lasting local anesthesia. So there is an additional cost. We talk about Exparel. We talked about it in our podcast about
with Don Merrill.
Yeah. Well, we also talked about it in tummy tucks.
Tummy tucks too. TAP blocks, TAP blocks with Exparel, which is a liposomal bupivacaine.
Yeah, it's non-opioid.
Non-opioid, and it lasts for about 3 days. I disclosed personal HIPAA information, Amy. I had a hernia surgery. They used Exparel. Right. Yeah, they used Exparel with Dr. Weaver, one of the best general surgeons in Denver. I highly recommend him. And I didn't have pain for 2 days. I even texted Weaver. I'm like, "This is nothing, man." He kind of
just wait.
He did the laughing emoji. Literally in 12 hours. Yeah. When that stuff wore off, I'm like, "Holy crap! I just got shot in my groin."
That is kind of the downside for some people. It wears off really fast. They have like a quick onset and a quick offset, so they'll feel pain kind of rapidly.
So if you're going to an office, like Amy's saying, I just want to say this, and you're going to do a regional block, like a TAP block, TAP, or a PEX 1 and 2 block, that's for the breast area. Most places you'll have a charge for that. Additional charge. And they may even charge you for the Exparel. Yep. The Exparel itself is very expensive, so you may have like an add-on charge to the facility fee, or they may be an add-on charge for the anesthesiologist doing the injection.
To actually do the block, yeah. Yep, and Dr. Merrill would actually...
Episode 15.
Oh, episode 15 with Dr. Merrill. Perfect, thank you. We are way back in the Wayback Machine.
I feel like we're really old.
Yeah. Dr. Merrill was great because he would actually do an epidural for our tummy tuck patients, and he would come do the epidural himself. So there's extra time for him. There's an extra cost. And I was actually kind of surprised at the amount that was charged for the Exparel.
In a good way or a bad way?
In a bad way. It was very expensive. So just know that if those are things on our quotes specifically, we specifically state that the OR and anesthesia are estimates. They are based on factors somewhat out of our control. If you decide to add on things like Exparel or other types of anesthesia, stay an extra night at the hospital, those are things that will be in addition. But those are good things, again, to go over with your doctor's office first. Does this cover long-lasting local? It's a good question to ask.
Yeah, by the way, if there's a charge for Exparel, let's say it's a couple $100. Hopefully, that's probably more than that. But to say it is, do it. It's worth it. That a couple $100 will give you 2 days, at least a day and a half, maybe 36 hours of a lot less pain.
Yeah. So going down from there, so we're stepping down the ladder. First assist. So that is a cost that's on a lot of our quotes. What is a first assist?
What is a first assist, Amy?
A first assist is a very specifically trained nurse who assists in surgery. It is a specific type of certification.
It could be a PA. It could be a PA. Yep.
Yep. They're typically nurses or PAs that are trained specifically to assist a surgeon.
Right. And they may not be a nurse. So a certified first assist is a training program. Anyone in this room can do that.
You have to be a nurse.
Oh, you do?
Mm-hmm.
Well,
or a PA.
Really?
Yeah. You can't just go be a first assist.
Are you sure?
I'm positive.
Okay.
At least in Colorado.
So my mechanic can't just go be a first assist?
He go be like a scrub tech or other things, but at least in Colorado to be a first assist, you do have to have gone through.
It's a Colorado thing.
And I don't know if that's true in all states, but that is true in Colorado.
All right. That's why you said it's a nurse. The first assist is the person that I have as my right-hand man or woman. They come in and help me with the surgery. And why is a first assistant useful sometimes, Amy?
So they're really great for longer cases, and that's usually where I will put them on. In cases that are over 3 hours is usually where I will then add on a first assist, and that's for two reasons. That's going to be helpful for keeping the total OR time down, which helps keep all costs down, keeps your anesthesia costs down, keeps your OR costs down. It also helps the surgeon just go through things a little bit more efficiently. You know, when you think about some of these bigger surgeries, people can imagine this in their mind. You're one person, you have two hands. You probably can't be holding everything, seeing everything you need to see.
I kind of feel like I have, like when I'm in the zone, I got like 4 arms going on.
I think you do, actually. I'm pretty sure I've seen the third arm
what is
come out.
There's that god, that Indian god with multiple arms. Vishnu, yeah.
Yeah.
That's what I feel like in there.
So even when you are, there's still a benefit of having someone else who is specially trained specifically to assist in surgery, because the scrub techs that are in there do a lot of different surgeries. You know, they might not be trained specifically on these surgeries. They can suture for you, which helps when you're, maybe closing really deeper layered things. Dr. Barn always does the important sutures, which are the ones on the top layer. But like for some of these deep sutures, if they can both be suturing at the same time or stapling something, like things just go a lot faster.
Yeah. And so when you have a first assistant like I have, like the ones that we use, they're amazing. Most of them, like a lot of them, have been surgeons in other countries and move here and decide they just don't want to go back to medical school. So they actually are trained surgeons, and they definitely make the surgery so much faster, more efficient. And why is a shorter surgery important? Number one, it saves you money, but most importantly, it's safer.
Well, and it can mean you can have all the things you want done at once sometimes.
And so, we've talked recently with the last episode about weight loss and surgery after that and combining procedures. You bring a surgical, we should have said that in that episode, the surgical assistant in that procedure, you can maybe add on another element to the surgery itself, because the surgical assistant can give you 45 minutes to an hour of, added time that you can utilize.
Yeah. So they're not the person doing the surgery. That is a key difference. They're not doing your surgery, but they are assisting your surgeon very closely.
Suturing, retracting, holding, maneuvering, cautery, so many different things. And, it's so funny when you use a surgical assistant, and I don't always, I'm very insular, but when I do, it's so funny because there's so many things that add up to a lot of time. Mm-hmm. So every time I have to grab something to cauterize it, or every time I have to grab and hold on to this, and do this and do that. When the surgical assistant is doing it, that saves me 4 seconds there, 10 seconds here, 30 seconds there. And then before you know it, it's like 20 or 30 minutes. And it's so funny when you're looking up at the
like,
the
why
clock.
am I done already?
Why
took me
this
3
is so
hours.
crazy how fast this was. I'm so amazing. And then you look over and there's Andre, the surgical assistant. And I'm like, oh shit, it was Andre. It's not me.
Good. Yeah. So next one on my list here is going to be the cost of equipment or implants. So you think breast implants, obviously there's a cost for those. For the facility we work at, that cost goes directly to the hospital, so we don't see that money at all.
Some doctors, they'll take the money directly to them and they'll buy it and bring the implants with them.
And we used to do that. Now we work at a facility that likes, for, safety reasons, whatever, make sure that they order the implants. That's fine with us. But also other types of implants, chin implants. We talked at the very beginning about BodyTite, like the cost for technology. If you're paying for anything that's disposable, meaning like the BodyTite handpiece or CO2 resurfacing tips or whatever you're using, like that extra equipment charges will be something as well.
Yeah, and if you don't see that itemized, it's not that they're just doing you a solid.
It's probably in the facility fee.
Yeah, they add that in just so you know. Like this stuff is not free. This is the thing that you have the conversation, and I get it. Amy, again, and I are both frugal. We're like, but it doesn't work that way. There's not some special like gift here, here, you could have this, especially when it comes to paying patients. They're going to make you pay in healthcare.
Yeah. Yeah.
So,
fat transfer cannulas, or equipment for that. There are a lot of other disposables that are not part of what's built into the facility fee that might be additional.
Right.
Those usually are a large amount, but with implants and things like that, they can be significant.
Yeah, and breast implants will depend a little bit on the volume of the surgeon. So, historically when we weren't they weren't getting bought through the facility itself and we were buying it through our practice, we're a somewhat higher volume practice. So the cost of the implants were a little less for us and we would pass that on to the patient. But the facilities, they just have a set cost markup, whatever they get. Yeah. And that's what it is.
Yeah. And their prices are fair.
They're totally fair.
They really are. The surgeries or the facility we use does not mark up their implants.
They don't? Oh, that's interesting.
Direct patient. No, I mean, at least not from what the list price is. Now, whether they're getting them for a negotiated rate and they're charging the list price, but they are charging list price, which I think is very fair. One thing with implants is there are many manufacturers. There's a way that some providers will try to make the overall cost of breast augmentation look lower by using a saline implant, because a saline implant is about half the cost of a silicone implant. It's not worth it. Don't do that.
If you see an advertisement for breast augmentation and it's like really low, I bet you that's for saline
They're
implants.
using saline. Yep.
And why would you use saline implants unless you just absolutely don't want silicone? Silicone is superior in every different way.
Well, and the shell is still silicone, so you're still getting silicone.
I know, but for just to say whatever reason you want saline, I don't know, it's in your head. I mean, I get it. But other than that, there's no reason besides cost. And if you can't afford a silicone breast implant, you shouldn't be doing a breast augmentation.
Yeah. If that, $800 to $1,000 is enough that you can't afford it,
then you shouldn't be doing the surgery. Yeah. I mean, is that terrible to say?
Well, people make financial decisions based on a variety of reasons, but yeah.
Sound like a dad.
Yeah, something to think about. Yeah. And then
you shouldn't be doing a surgery, young
if you can't afford
whippersnapper.
Yeah. Very bottom here, I've got overnight stay. An overnight stay fee is, again, going to run the gamut of cost. There are some facilities we've worked out in the past that actually do not charge for an overnight stay. They kind of just include it. Other facilities, the overnight stay has been almost $2,000 to stay the night. I'd say on average, that fee is going to be anywhere from $500 to $1,000. That does include, nursing care overnight. It's including IV medication overnight.
If you're doing it in the doctor's office surgery and they bring a nurse in, they may not charge you for the nurse. They may just add that onto the facility fee.
But it's in there somewhere. So if you're staying the night, that fee is coming from somewhere. And knowing if you can stay more than one night is a good thing to ask too, because if you do stay a second night, sometimes the second night is less. That was actually, oh my gosh, back in the Aspen days, the fee for the second night was like half the price.
You're kidding.
Oh no, so it was great. So I was just like, just stay the second night.
Well, I would.
Yeah. Like, why go home?
Do you think the third night's like free? You could just stay another night?
Right. Buy two, get one free. Maybe. So good things to know.
And Aspen Hospital was amazing because you would overlook the mountain.
Oh, it was gorgeous. You had beautiful views. Yeah. Except when they were doing construction. So let's take a quick break. It's a good time for a break from our sponsor. Let's Get Checked, and we'll be back.
We'll be back.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah, and Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah, so as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's let you know where you're at and what's responsible.
All right, well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, welcome back, everyone. We're back to talk more about money. The big money questions here.
This is like such a huge topic for people, but what's interesting? I feel like the internet in the past 10 years has actually helped with this issue, because I feel like people have more access to information and they start to understand why these numbers are what they are, right?
Potentially, but I think the downside of that is there is a lot more direct to consumer marketing of kind of malicious treatments and services.
How we've dealt with this podcast, it's about empowerment of the listener and for them to understand, possibly what they're getting into with surgery. I think that, what we've found, at least with the patients that come in our office, they're smart enough to figure all that stuff out in most cases. With that said, it can get very confusing, especially if you go into an office that's very sales oriented. It doesn't mean it's a bad office, but they may say to you, if you sign up now, we're going to give you 20% off or 30% off.
It's easy to get wrapped up in the hype.
Do you know what I'm saying?
Yep.
Like if we have an opening, we just had that yesterday. We have an opening in 2 weeks. This is like this person wanted a second opinion. We have an opening in 2 weeks, and if you want the surgery, you got to sign up right now. You don't
that's very common that offices will offer you a discount for signing up for surgery the day you're there for consult.
Right.
I do not. We do not.
And so we don't.
It's not ethical.
Well, we don't do that. And God bless people that do, but it makes you feel like you're selling timeshares or something. Mm-hmm. That's the feeling I get.
Yeah.
And young people may not know what a timeshare is, but just ask your parents. Like, it's weird.
High pressure sales.
Yeah.
Well, we actually, the agreement we have with our implant manufacturers, we have to abide by their code of ethics as well. And that includes not doing a surgery on someone who hasn't had at least 2 weeks between their consultation and surgery. And that's to make sure that there is no coercion or a person is not under duress. Like there are specific questions. People around issues with their body and plastic surgery, it's very easy to get emotional about it. So you never want to pressure somebody into doing surgery when they're already in a state of like duress about a body part.
Well, I found that, I know this sounds weird, but I found that with our dog, because our dog's sick, and you're emotional about this helpless little being, this beautiful little dog, and of course, whatever they put in front of you, you're just going to pay it.
Yes,
right?
like I'll do it.
Yeah.
Like,
So if I would really dislike my breasts and I wanted them better and it was, emotionally bothering me, and someone said, well, if you just sign this paper right here, 20% off, let's go.
we'll do your surgery in 3 days.
We'll do your surgery in 3 days or 4 days. We have an opening right now. If you sign right now and give us $1,000, we'll do your surgery. Is it so bad that they would agree to do that? It's something that really bothered them. The problem with all this stuff is that you got to sit back and make a rational decision. That's everything we talk about on this podcast. These surgeons are not, in most cases, not malicious. Some of them are. Some of them definitely are. But
not all people are good people, even, and that includes doctors.
Yeah, but most cases they're not malicious. But this is a business. They're there to sell you a product.
It's not a non-for-profit organization.
Right. And there is no free meals, free lunches when it comes to this kind of stuff. If they're giving you 20% off, that means they're not busy or they do such a high volume that they just don't care. Okay? And those two are not great. That's not great. You don't want to be in a high volume practice and you have an issue because you may not even see the doctor because he's going to be doing surgery from 6 a.m. to 12 at night. So I think that you need to really be smart about what you're doing. It doesn't matter. You can still go to a high volume practice, but you need to be really smart and kind of break it down with what we showed you before the break. Okay.
Yeah. So with all that said, all the things we talked about before, kind of the nuts and bolts of what goes into your quote, right? Or the cost that is presented to you by the provider. But here's a list of things that are not included on there, or most likely not included, or may not be included, that you should definitely think about ahead of time. The number one thing being, I'm going to group all of this together, meaning medications, pre-op labs, mammogram, medical clearance, testing, EKGs, all of this stuff that you might need to have prior to surgery is likely not included. I would be very surprised if any of those things were included on your quote. Medications you're going to get from your pharmacy, pre-op labs are going to be done at a lab.
We do T-Relief.
We do, but that's included on our quote.
Yeah.
Yep. So medications, meaning your antibiotics, you are going to get from your pharmacy.
Right. You're going to have a copay on that for sure.
Yep. Your pre-op labs. Most doctors' offices, even if they draw your blood, they are not the lab. So if they draw your blood, they're still sending out to a lab. There's still going to be a cost from the lab. If you need an EKG, you will likely end up having to at least pay a copay. If you need a mammogram, all those things may have copays. If you just have to visit your doctor to get medical clearance because you have some medical issue that needs clearance, those are all things that may have a cost that are very unlikely to be included in your quote. The cost might not be much. Medications we prescribe prior to surgery are very inexpensive, can all be filled generic, probably less than $30 total, but that cost is there. Garments is something that may be included on your quote and may not be. Sometimes it's provided by the hospital. For us, with our tummy tuck patients, your binder is provided by the hospital. Until your drains are out, that's all you get to wear. After that, I'm going to give you some suggestions about garments to buy. Breast augmentation, you're leaving wrapped. I'm going to give you suggestions of garments to buy. And a lot of the reason why we don't provide specific garments for some surgeries is just because there's such a variation in body types. We did provide them at one point in time and everybody hated them. Remember everybody hated, oh my gosh, the bras. We tried so many different surgical bras. It was Goldilocks. Like none of them were just right for everybody. So we kind of came to the point
and
where
you can't wear them again.
You can't wear them again.
You're going to spend $80 to $100 on a stupid bra that you can't
hate.
wear.
Yeah. It just became a lot easier for us to give suggestions.
Bra.
Like here's some suggestions of bras that that are really great.
Right.
We recommend. You have to buy these prior to surgery. Wound care supplies is one I put on here because this is also something you may not think about. Like, what am I going to need to take care of my surgical areas after surgery?
Yeah, antibiotic ointment, this or that. Yeah.
We have a pre-op shopping list that we send people that has a list of a lot of things on it. Bacitracin is one of those. But there may be other supplies too that just, you need. You need
right.
some.
Our office is very well prepared. That's all Amy. A patient just told us recently that your office might, like my husband or somebody had some sort of joint replacement. And our preoperative preparation was way better than the joint replacement.
Joint replacement?
And she just had like a breast augmentation or something small. And of course my chest was puffed out, but at the same time I was like, oh, this is terrible. This is not how medicine is. So, some of these offices you go to, this may not get itemized and broken down for you. And that's a problem. But I guess you could have a discussion with their office staff and say, what should I expect after surgery? What do you think I should, conceivably have to pay for?
And a lot of patients do ask me that, like, what additional costs will I have on top of this? Or I'll volunteer it. On top of this, you will have the cost of your pre-op medications and a little bit of lab work or garments. Like those are things I say to people. On our quote, we break down everything. If it's not on my quote, it's not included. It's not hidden in there somewhere like it is not included. But a lot of other offices might just group it all together as one set cost. Like, here you go, it's $3,500. Take it or leave it.
Okay, so we can ask Nils this question.
Oh.
So would you just rather have a bulk fee or would you rather have it broken down?
Oh, I'm a attention to detail. I like everything broken down.
Yeah, see, I am too.
Yeah. I don't like.
I want everything broken
I wanna know
down.
what I'm paying for.
I want to know exactly what I'm paying for, and I want to know exactly how much this or that costs.
Maybe to a fault.
Right. No, I'm the same way. But some people are not. Some people emotionally just tell me what the cost is.
Yeah,
and,
tell me what it all is.
and I'll do the financing or whatever I need to do to get it. So it's interesting.
Yeah. So here's some other additional costs. So these are things that are probably, again, definitely not on your quote. Most of these ones are for sure not on your quote. But
Oh
are
yeah, these are huge.
things you need to think about when you're considering the total cost of surgery. Number one being post-op care and or nursing care. Like if you are a single person, if you don't have a family member who's able to take care of you and you require some like intense post-operative care or you traveled for surgery, how much is the nursing care going to cost? Or you have to pay somebody to come and help you, even if it's your sibling, even if it's just dinner out. That might be an additional
just
cost.
putting up with your sibling is payment enough,
Yeah.
but then you have to pay him on top of that. It just seems like that's a bad deal.
If your sister's coming to help you with your tummy tuck, she's going to want to be paid.
Yeah.
Extra help at home, cleaning, childcare, driving, I put on there because, if you are having to, get your kids to soccer practice a day after surgery, you are probably not going to be the one driving them there. Do you have someone who can do that? Or you have to pay your nanny extra? If you don't have a family member who's able to pick up the slack on those things, a lot of our surgeries require that you not be lifting anything for several weeks, meaning even laundry or vacuuming your house, specifically vacuuming in some cases.
Some people like this. The significant others don't. But they like the fact that they can't do anything for a couple of weeks.
Like, can I vacuum yet? Yeah, absolutely not. It's been 3 weeks. No. So let's talk about time off work.
Yeah. So this work thing, especially people that are employed and they have this PTO racket, which I don't even understand, but apparently they accrue time they can take off work.
Paid time off.
Yeah, I like that.
Some people have like 6-8 weeks of PTO.
Some people have like months.
Yeah.
Like, how is this
saving it up.
possible? Do you not go on trips?
Yeah.
And then you've talked to people about FMLA too, so that plays into it. But sometimes it doesn't cover the amount of time you need off.
Yeah, if you need to take off 2 weeks, like you might have a week that you're willing to use of your PTO. Some places require that you apply for FMLA after you've exhausted your PTO. But if you just decide like, no, I don't want to use my PTO, you just want to take time off and save your PTO for vacation, to me, that's kind of the cost of surgery.
Sure.
Like, 2 weeks of not being paid is kind of the cost. We certainly have a lot of patients who do use their FMLA, and that's totally fine. And an option, if your employer allows it, will help you fill out the paperwork for it. But just keep in mind that if you do use your FMLA for your plastic surgery, it will not be available should you need it for its intended purpose, which is to take care of yourself or a family member in case of emergency.
So FMLA is like a reserve that you can't just refill.
Yep, it's a Family Medical Leave Act, but it is available to you. So that's something to keep in mind to kind of help maybe cut the cost of your surgery is.
Yeah, so that that could be
PTO.
sizable. I mean, this could be a sizable cost to you if you don't have enough PTO and FMLA doesn't cover if you have to take off 4 weeks or 6 weeks.
Yeah. And, that to me, like I said, is definitely part of the cost consideration overall.
Right.
For sure. The nice part is with now, with a lot of people working from home, you might be able to do some work or partial work or just knowing ahead of time, though, how much time you're going to need off is a big deal to me.
Sure.
It would be a big deal. So, Dr. Brown, what's this last one we have? It's kind of, to me, the big one.
Need for additional surgery.
So this could be two types of surgery. This could be additional cosmetic procedures or revision surgeries, but it could also be need for additional surgery could be unrelated to your surgery. It could just be an issue that comes up. We had a patient who had a combo case with us and a general surgeon. She had a postoperative bleed. She needed additional time in the
From
OR.
the area of the hernia repair.
Yeah, not from a plastic surgery.
Not from our plastic surgery.
But it did mean we had to go in and you opened up your beautifully sewn shut tummy tuck again. So sometimes the need for additional surgery is immediate. We did have a patient who needed additional breast surgery right away. These are costs that are not in your quote. Like you may think they should be, but they are not. So if you need to go back in and have your implants exchanged a week after surgery, there's going to be OR fees. There's going to be anesthesia fees. There's going to be the cost of the implants again. Like these fees can all exist again if you need additional surgery.
Right. So there's obviously medical mistakes, but then there's things that just happen that really aren't related to technical ability or outcomes. Some people in a delayed fashion can have bleeding. Some people can have infections in a delayed fashion. Some people can fall down and hurt themselves. I had a patient 3 weeks after surgery fall down and hit her breast right where we did surgery and just destroyed everything. And this was at work. So It wasn't like that was related to the surgery itself. And she was bummed, but you're going to have to pay for some of that.
Mm-hmm.
These are the realities of surgery. Again, not trying to beat a dead horse here, but if you don't have enough money to do surgery, don't do it, because you may have an extra cost after this that you had never expected would happen.
Unanticipated costs. Yeah. And even little things, the need for additional surgery might be like a little touch-up procedure. Most offices, ours included, is going to have a fee for that. And that fee covers, going back to the very beginning, the cost of supplies. We charge an extremely nominal amount of money for revisions or touch-ups, and they in most cases do not even cover the full cost of supplies.
Right.
They barely cover it. They don't cover the cost of staff. So they don't cover the cost of the medical assistant or anybody else who's in that room. They don't cover your time. They literally cover the cost of like the sutures and the surgical pack, and that's it. So that's a good thing to ask.
Yeah, why do we do that? That doesn't seem like it's a good deal for us.
It's not a good deal for us, but that's because we care.
Because we're perfectionists, yeah.
And we care about our outcomes, but that is something to ask, if you're having a surgery, like what is the charge for revisions, or is there a touch-up fee? Most cases there will be. So that is something to think about ahead of time. So I think we have covered the things that go into the cost of surgery in pretty good detail.
Yeah, and everybody wants to know exactly how much a breast augmentation costs or exactly what a facelift costs. And you can't answer that question. It depends on your market. It depends on your surgeon's fees.
Depends on you.
It depends on you, what you need exactly. It depends on the facility. Is it a hospital-based facility? Is it freestanding ASC, doctor-owned surgery center? Is it the doctor's office? How much does the anesthesiologist cost? Do they use a CRNA? Do they use an anesthesiologist or an anesthesia assistant? What are the other things? I don't know. Everything else we talked about.
Do I need postoperative nursing care? A week off work?
Right.
$1,000 for surgical garments.
So I know that everyone wants to get to some number like this is Priceline. Okay, it doesn't work that way because everything's so specific to that area and region and doctor's office and you as a patient. But empower yourself, itemize this out, really figure out what these fees cost, and then make your decision. One last thing I'll tell you is that, again, coming from 3 frugal people in this room, including Nils, we get, trying to really figure out what the best deal is, all right, what you can get the most for your money. But in the end, don't pick the surgeon only because of money.
This is your life.
If you do that, you will regret it. Now, there's a lot of cases where it works out just fine. But if it doesn't work out, you're going to have such regret. And we get so many patients in our office like that.
Oh, well, there's no guarantee that you picking the most expensive surgeon is going to guarantee you the outcome that you desire.
Exactly. But my point is, don't just make it all about money. Make it about, do they understand you? Do they understand your vision? Do you feel like they get you? Does the office look like a nice office that would actually return your phone call? Okay. Do they seem like they care? These kind of things matter. If you're going into an office just because it's the cheapest place, but no one there cares about why you're there and you're getting a bad vibe, don't do surgery there, right?
Yeah.
I mean, really.
My final piece of advice with quotes too, we always highly recommend that you get multiple consultations. If you have one that is the outlier, high or low, that one might not be the one. If you have a range where they're all pretty close, and I know, when we've had patients give quote, tell us what they were quoted by other physicians, we are usually well within the normal range. I've had patients come to me and tell me an X amount for a surgery that is more than double what we would typically charge. That's, again, if it seems
maybe that surgeon is double as good as me.
Like far too high or far too low than what you're seeing from other doctors. Maybe
that guy's really good.
Yeah.
4 hours.
What we should do? This kind of goes back to our last podcast with the multiple consultations. I'm just going to keep doing the podcast while you guys talk.
I'm sorry. I'm joking with Nils.
I'm still here, people. I'm still here. Dr. Martin is mentally checked out.
I've got Nils here.
We should
to my right shoulder. This is where Nils sits, over here to the right side.
If we were ever to do, I think, a reality TV show about plastic surgery, because people tell us all the time that we should. I actually think it should be far less like Dr. 90210 and far more like House Hunters, right? Like where we go undercover with the patient to multiple consultations and then help where they're sitting there at the end God. I hated the fence on this one. Well, that one's out. Like definitely not the lake house. Like definitely not the doctor who's charging $100,000 for a facelift. Or definitely not the non-board certified doctor who's doing lipo, right?
Show.
Like I think that would be a great show.
Yeah. But
crowdfund us.
But I mean, how is the patient going to describe you and I when we're there?
We're their friend.
Okay.
This is my sister.
Or camera glasses.
Oh yeah, we could be in their ear. Yeah.
We could go under
like
disguise.
Ask them this.
It's so funny. Undercover Boss. Every one of them has like a mullet and a beard. or the women just look, totally not like themselves. They don't look like a real person most of the time.
Yeah, they look like they're dressed up.
Yeah.
Yeah, we'd have to do better than that. But all right. Well, thank you all so much for listening. Sorry, we kind of drove off we do that sometimes at the end of podcasts. So if you've listened this far, thank you. We appreciate you listening. Appreciate you sharing this with your friends, anyone who might be interested in listening to this podcast. If you were wondering about the cost of surgery or you know someone who is. Also, we do appreciate if you leave us comments, likes, rating, reviews. They really do mean a lot to us, and they help other people find our podcast as well. So you can find us on Instagram at Beauty and the Surgeon Podcast. We're on YouTube at Jason Martin MD. And the phone number is in the drawer.
Oh, here we go.
Because I forgot to bring the phone number out.
You don't know it memorized? You don't have it memorized?
If you listen to our last podcast, you know that we do have a voicemail, and we do listen to those voicemails and answer those questions from time to time on this podcast. So you can find us.
We actually played the voicemails the last episode.
We did. The phone number is in the description box along with the chapters for this episode, but that phone number is 303-630-9038. We do appreciate everybody listening.
And subscribe to our YouTube channel because we're growing. And when we get 1,000 subscribers, that's when the swag is really going to come out.
Get merch.
I'm already planning it.
Yes. All right. Thank you so much, everyone. We will see you soon.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.